My name is Magda Puchała, and together with me will be present Monika Lobko. And we are so glad for being here with you today at the Aptamers conference. We've got the pleasure to represent PureBiologics company and present our data of one of our Aptamer-based projects. And today's presentation is devoted to the development of a medical device, which is a biomolecular filter comprising an Aptamer-based selective adsorber that will precisely capture pathogenic autoantibodies from patients' blood. And to tackle this challenge, we used our modular Select PureApta platform to identify chemically modified DNA aptamers towards these antibodies. Oh, sorry. Okay. Mentioned antibodies, AQP4 IgGs are a key factor of neuromyelitis optica disorder, which is also known as Devic's disease. NMO is an autoimmune disease associated with pathogenic autoantibodies against aquaporin 4, which is the most abundant water channel present in astrocytes membranes in the central nervous system. It produces inflammation and demyelination, and leading to the damage of the optic nerve and the spinal cord, and can cause pain, loss of vision, paralysis, and lead to respiratory and circulatory failure. Due to the fact that NMO is classified as a rare disease, there is a significant shortage of effective therapies, and current NMO treatment includes steroids, off-label immunotherapies, or plasmapheresis. However, they may cause some undesirable complications during the treatment. And to avoid them, we focused our research on an improvement of plasmapheresis method. So here we present the animation with the proposal functioning of therapeutic medical device.
Apheresis is a medical procedure during which selected blood components are separated and removed, and the purified blood is returned to the patient. In the event of exacerbations of the Devic's disease, a therapeutic plasma exchange procedure called plasmapheresis is often performed to remove the disease-causing molecules from the blood. Usually 4 to 6 treatments are performed, and the patient's total plasma volume is replaced with fluids. Scientists have developed a method of immobilizing the aptamer to an activated resin, which allows for aptamer utilization in cartridges, similar to those commonly used in the therapeutic plasmapheresis procedure. In the case of an aptamer selective filter, the key benefit for the patient will be that the plasma is cleared of NMO autoreactive antibodies and the cleared plasma fully returned to the patient.
And by doing so, we hope that this procedure will avoid some adverse plasmapheresis related complications. We should start from the selection of aptamers, and for our in vitro selection we use our modular PureApta platform to identify chemically modified DNA aptamers, it was performed towards recombinant AQP4 IgG. And our platform is based on obtaining a modified nucleotide. And in this case, azidomethylchlorobenzene was used as a side chain of ethanol deoxyuridine, which was incorporated in a standard click chemistry reaction. And prepared modified nucleotide was then incorporated into the sequence by enzymatic primary extension reaction, in which each deoxythymidine in the sequence was replaced by our modified nucleotide, shortly named CLB-DUTP. And prepared in that way, a modified library was then subjected to 7 rounds of selection. And to ensure selection of target-specific aptamers, multiple counter-selection steps were extensively performed. And after NGS sequencing and bioinformatic data analysis, we identify over a dozen of promising aptamers, Aptamer candidates actually, and one of them, APS85, showed satisfying affinity towards AQP4 IgGs, so it was chosen for further experiments. Modified nucleotide present in the sequence may be involved in the interaction with target, as well as create new secondary structural motifs. And therefore, we compared the interaction of modified aptamer and the aptamer with all natural DNA nucleotides. And in the standard ELONA experiments, as we expect, non-modified aptamers show no interaction with the target in comparison to our modified original aptamer. Also, in an experiment in which the aptamer was immobilized on neutrophilin agarose resin and incubated with the antibody in the solution, the figure illustrates well that the modified aptamer capture all antibodies from the solution, while non-modified aptamer binds very weakly and non-specifically, since all bound molecules were released during the washing step. So after these experiments, we decided to truncate our aptamer. We truncate from both from 3' and 5' end, and the affinity was measured by biolayer interferometry. And as it turned out, for each variant, the interaction with AQP4 IgG was very clear, and as can be seen on the presented figure, was very clear and unambiguous. And we were able to truncate the aptamer from 76 to even 25 nucleotides, maintaining an equally good KD at the subnanomolar level. We tried to shorten the aptamer even more, but a loss of interaction was observed. So this is our final molecule. We also checked the aptamer specificity by incubating the aptamer with counter targets used in the selection process. It was antibodies and blood components, and in the most cases, there was no interaction or several orders of magnitude lower than for our target. So we can assume that aptamer can be considered as specific for binding AQP4 IgG. This leads us to the next point, because chemically modified nucleotides have been used to improve the efficiency of SELEX and affinity to the target, but also to increase the endurance of aptamers to prevailing environmental, to increase the endurance of this aptamer in the prevailing environmental and physiological conditions. And the plasmapheresis process can take up to several hours, so we need our aptamer to be stable for a very long time and to not degrade during the process and getting into patient's bloodstream. So for this purpose, by means of primer extension reaction, we have produced aptamers containing double modification, where apart from CLB DFDP, our original modification, we introduced nucleotides that could increase nuclease resistance of aptamers, and they were replaced as natural nucleotides. And all variants were incubated for up to 48 hours in 100% human serum, and the half-life of the original aptamer was extended to 4 hours in comparison to non-modified aptamer, which was actually very satisfying for us, but further introduction of modifications resulted in extension of stability time to even 8 hours for all sequences with double modification. So our post-selection modification of aptamers increase the stability of Aptamer, but when it comes to affinity to AQP4 IgGs, only for additional fluoro-DCTP nucleotide, it was identical to the original Aptamer. In case of other modified Aptamers, the interaction was less, there was lower affinity, but the interaction was more non-specific. So these are our latest data, and we will still continue to optimization of this molecule so that fulfills its function as well as possible. And now Monica will give you more details about biomolecular filter comprising optimized Aptamer.
So our next steps were focused on immobilization of Aptamer on agarose resin and on determination of binding capacity, which we defined as the amount of target protein which we are able to capture by our immobilized Aptamer before significant breakthrough of product is observed. And we set up the level of breakthrough arbitrary as 10%. Static binding capacity was determined in initial small-scale batch mode experiments in order to find optimal conditions for Aptamer immobilization and target binding. And also it serves as our internal quality control test in order to check larger batches of immobilized Aptamer. The dynamic binding capacity was further determined in order to, in a flow mode experiment, for adsorbent development, and thanks to flow mode applied here, it reflects better the real process performance. Okay, so here we show the example of determination of static binding and dynamic binding capacity for the same batch of immobilized Aptamer. On the left panel, here you can see the result of batch mode experiment in which subsequent portions of target protein, which is AQP4 IgG, were loaded, mixed with the resin, incubated, and then the flow through was connected. So what we see here as flow through fraction is unbound fraction. The amount, it reflects the amount of IgG which remain unbound to the resin. And we see that thanks to densitometric analysis, that 15 micrograms here is the maximum amount which we may load on the resin before we observe the breakthrough exceeding 10%. So this is our static binding capacity. On the right panel, we can see the results of flow mode experiment. So here we see the chromatography chart. First is a loading phase here, and then we have the elution phase. And in both phases, we see significant difference between control experiment, which is yellow line, in which we have non-binding conditions, and blue line, which shows an effect of our column with an Aptamer. So what we see in the loading phase is the amount of protein which is unbound. And based on that, we can find the point when 10% breakthrough was achieved and calculate the dynamic binding capacity. Calculated dynamic binding capacity per 1 milliliter of resin is lower than static binding capacity by around 40%. Then we want to understand if we can use our column multiple times. And here we see again the loading phase of the chromatography chart. The yellow line is a control experiment, non-binding conditions, and blue and green lines shows subsequent usage of the same column. And we see that this line overlay almost perfectly, and capacity calculated based on that does not differ by more than 10%, and no trend from run to run was observed, which allows us to conclude that the column is reusable. Our next question was if the autoclaving process will impact somehow the binding efficiency of our column. And here we can see the purple and blue line is our experiment with column, autoclaved and non-autoclaved. Yellow is again a control. So when we compare it to control, we see that in both cases we observe target binding. However, when we look deeper into differences between these two columns, we see that the capacity of autoclaved column is lower, what will need to be taken into account when we will design a larger scale final column. And to sum up, our achievements for the last couple of months is that we were able to shorten the aptamer from 76 to 28 nucleotides, what decreased the costs of our research and the final product significantly. We improved aptamer stability. We also switched from neutropidine biotin immobilization, which we showed on last conference, to direct covalent immobilization, what reduced the risk of leaking of our ligand. Presented results confirm that our column is able to capture AQP4 IgGs under flow mode, and the column is both reusable and autoclavable. In the future, we plan to continue develop the prototype of the column and design a final scaled up column for pilot preclinical studies in animal model. Yes, and at the end, I would like to thank our teammates, our mentors, and co-founders. Thank you for your attention.